we are going to go through a full treatment video for how to treat symptoms of a disc herniation. Welcome to the Neck Fixx Pro YouTube channel, where we give you the tools to fix your neck for a healthier future. My name is Scott. I'm founder and creator of Neck Fixx Pro. I'm a doctor of physical therapy and have been a physical therapist for almost 15 years. I've treated thousands of people with neck pain, and this is the best possible solution that I've come up with. We're going to start off with what is a disc herniation. A disc herniation is when you have this little piece of a disc that gets into the little space where those nerves exit out of the neck right in the back. A lot of times that will cause radiating pain either down into that shoulder blade area, or it'll also go down the arm depending on what level that disc herniation is at. So we're going to go through a full treatment video on how I would treat a disc herniation. We're going to start off with our Neck Fixx Pro. We're going to take little nubs. Those are going to go right into the back of the neck. From here, we are going to put hands into those end loops. Okay? Nice and easy, especially if the neck is aggravated and you do have symptoms going down the arm. It's going to be really nice to start off nice and light. We're going to be using the comfort band here. So starting off, just little side to side, I'm just going to try and get those muscles to just calm down a little bit. You can kind of go up and down, just little lift off, and just little side to side. You're just really trying to get onto those muscles. You're not really super tense with the neck. I just want nice and easy, not a whole lot of resistance, but if you want to add a little bit more pull, if it's not too aggravated, you definitely can add a little bit more. I would just kind of work up and down. If you look at those little cervical paraspinal muscles, they run up and down the side of the neck. So going all the way kind of to the base of the skull and then down into, kind of that base of the neck, right where it kind of meets into the shoulders. That's going to be a really good place to kind of work through all of those muscles to get it nice, loosened up, and just to kind of give those joints a little bit more room, a little bit more space. And especially when nerves get aggravated, they tell the muscles to tighten up to try and protect the area. So if we can get those to just loosen up a little bit, that's going to help with just the pain in general and just let them loosen up and get them moving a little bit better overall. So once we've kind of loosened all those muscles up and just kind of nice and easy, just little side to side, going through there. Let's say that I have right side pain. There is numbness, tingling down my right arm. So from here, all I'm going to do is if my right arm feels a little bit weak, I'm going to go ahead and I'm going to rotate. So I'm going to take my right side and I'm going to anchor that down. So it really doesn't have to do much of the work. And then we're going to take this other side and all we're going to do is just kind of go up and just have a little pull. We're just trying to get a little bit of motion, just kind of up. So I'm not really letting it rotate. I don't want it to rotate too much. I'm just trying to open up that little joint on that right side to let it breathe a little bit and just give it a little bit more room to take some pressure off of that nerve. If right arm is okay, doesn't feel too bad, and you want to just do just little pressing, little up, you can add a little bit of rotation just for comfort. I just make sure you don't go through a big rotation. I want most of it to kind of be straight up, but if you have a little bit of rotation with that pull, it's not a big deal, okay? So I'm just gonna kind of do a couple of those. Again, just try and loosen up that joint. I'm not adding this big pull where I'm really trying to be aggressive. I'm really just trying to nice and easy, just kind of wiggle that joint a little bit. And again, just give that a little bit more room to take pressure off of it. To actually loosen things up, I'm gonna go both hands and I'm just gonna look up and add a little bit more aggressive of a pull, okay? So from here, I'm actually going up. I'm really trying to press out as I go, where I'm getting a nice amount of tension onto that band as I go up. Little pause, kind of reset. If it feels better and you just kind of want to hang out and just do, you know, little nods up and down, that's okay as well. There's no real right or wrong way to do all of these as far as the movement goes. If it feels better to kind of go through here and you're doing some of those repeat movements, do the repeat movements. If you prefer to just kind of hang out and just go up and down, that's going to be a great way to get things opened up as well. Again, kind of listen to your body, see what feels better. If one of those feels better, whether you're doing a little reset and kind of letting those muscles relax each time, or whether they're able to be up here and kind of relax into it, either of those are going to be good. And again, you can move that band up and down depending on kind of what feels the stiffest. You know, you can move it a little bit higher if you feel like it's a little bit higher, and that's where you kind of have that kind of sticky discomfort, everything else up there. So feel free to move that band up and down. If it is a little bit too aggressive at one level, try and change levels, either a little bit higher, a little bit lower from that level. And that's gonna allow you to just give a little bit more comfort, but still getting into those joints and into those areas to get a little bit more comfort, a little bit more comfortable with everything else. Okay. Once we've gone through little elevation, just nice, easy, almost little traction, where we're just going up and down, we're just gonna kind of reset. I want to check in with the neck every once in a while, especially if it is aggravated. I don't want to aggravate things even more. So whenever you kind of get back, kind of reset, check and see how your symptoms are, okay? If you have numbness, tingling down the arm, ideally I want it to start coming up the arm. If the hand's really tingly and then it goes into the forearm, that is a good sign. That's called centralization, where that numbness, tingling, all of that is moving up the arm. That's what we want to see. We want to see more centralized into the neck as opposed to peripheralized into the hand, elbow, things like that, okay? So all of those things are kind of those symptoms and signs to look for, but on a daily basis, the consistency with this is going to be more important than anything else. So really trying to get consistent throughout the day, 1, 3, 5 times a day, where you're just nice and easy, spending 3 to 5 minutes, just trying to go through this little program to try and loosen everything up. A lot of times when things are aggravated, being less aggressive and more consistent, more frequent with the treatments, it's gonna have much more positive impact on your symptoms and overall sensation, as well as being able to sleep better, being able to function at work better, and everything like that. Hope this video helps out. Hope it gives you a little template on treatment and how to fix your neck.